Radiation Protection at Forever Dental and Skin, a practical guide. Radiation protection is a very important subject within a dental practice. We have key responsibilities to protect the patients and protect ourselves when using ionizing radiation. The use of radiation is governed by two important pieces of legislation, which staff should be well aware of, which are IRR 99 and IRMA 2017. For further details of these, you may refer to the in-house radiation protection folder, and these will be discussed during your CPD. Here at Forever Dental and Skin, we have an appointed radiation protection advisor and medical physics expert, who is Paul Reed of Dent RPA. If you encounter any problems or have any queries relating to the use of x-rays and the local rules, you may contact Dent RPA and Paul Reed and discuss any issues you may be having or any faults you suspect with any of the equipment, as well as report these to the practice manager. The staff who are involved in taking x-rays and handling of x-ray equipment are trained on a regular basis through their CPD. The dentists are required to train in radiation protection once every 5 years as part of their ongoing professional development. Nurses are expected to be able to assist the dentists with setting up x-ray equipment and handling of the patient files and of labelling the x-rays. We use a number of x-ray pieces of x-ray equipment. We have a handheld Nomad 2 small x-ray generator. We also have a larger OPT machine, and the small x-rays are taken using a intraoral sensor. These pieces of equipment are checked on an annual basis by our radiation protection advisor and medical physics expert, Paul Reed, and a log of this is taken in the radiation protection folder, which all staff should know where it is and should be familiar with. Radiation compliance is a key topic and will be looked at by the CQC. They have responsibilities to ensure that all practices are compliant. You can see in the list of activities that the practice needs to be complying with. We are registered with the HSE as a radiation entity. We have a radiation protection advisor and medical physics expert. Dr. Murray Pratt is the appointed radiation protection supervisor. We've taken out a risk assessment for all the equipment that we use and how it should be used. This could be all staff should be familiar with the local rules, and a copy of those are displayed in the surgery and in the OPT room. The contingency plan for faulty equipment is primarily to turn the equipment off. So in the case of the handheld unit, you unplug the battery, and in the case of the OPT, you turn off the switch on the exterior of the room, and this will mitigate any faults that may be occurring. We keep a equipment log in the radiation protection file, and this includes the annual testing as well as ongoing testing of the equipment throughout the year. All dentists who are taking x-rays perform the role of referrers, practitioners and operators, and they are trained during their CPD cycles. And if you update your training, please send a copy of this to the practice manager so this can be added to your file. We have a quality assurance program in place, which we'll demonstrate later in this video. All x-rays are graded either 1, 2 or 3 based on their quality and whether repeat exposures are required to achieve a diagnostic image. We have referral guidelines in place, and yes, the radiation protection file is a joint responsibility to be updated, and any event should be communicated to the practice manager and then recorded in the radiation protection file. The radiation protection file also has the log log of all the equipment and the servicing history of all the equipment. All doses are kept to a minimum. You can find the settings that are recommended in the radiation protection file, but they are set as sort of standard on the equipment, which is user friendly. And we record the number of dental X-rays is recorded because it's recorded through the practice management software. We're now going to move on to a practical guide of how to use the different softwares and different pieces of equipment in the practice. The setup of the OPT machine is a key task during the setup of the practice every morning. You do this by turning the power on externally, and then you will see the machine booting up. Often you'll need to press the reset button and it will return to its reset position. This also calibrates the internal aspects of the machine, so it's ready to take the first X-ray of the day. You can see the positioning here. The X-ray machine will then be cleaned, ready for being used by the first patient. All patients use a new sleeve for each patient. The dentist will position the patient in the machine and also select the correct dosage based on the size of the patient, and then level them in the right position. The dentist then will stand at the window so he can keep an eye on the patient for positioning, and then press the button until the complete exposure is exposed. The nurse should stand at the door of the surgery and communicate that the X-ray is being taken. The nurse will then decontaminate the room and the equipment after the patient has left their appointment. This involves wiping the machine down with appropriate disinfectant and changing the plastic sleeve and making any other cleaning requirements so that it's ready for its next use. In this section we will describe how to set up for an intraoral X-ray, including bite wing X-rays and long cone periapical X-rays. This is a key task for the dental nurse in providing efficient and user-friendly service to the dentist. The OPT machine is selected by selecting this icon, and then you select the icon which looks like the OPT. You then get this which says ready for exposure. You should then stand at the doorway of the surgery, and the dentist will take the patient down to the X-ray room. As the exposure is happening, you can communicate that the image is being captured on the computer. This is a key task, so the dentist knows that the image is getting captured. Once you come back, you can close that and label it. We're now opening for an intraoral X-ray, so the icons on the left are for labeling. This is now reserved for an exposure using the intraoral sensor. We'll now show yeah, you can choose which teeth you want to label before, or you can label them afterwards. If you know how to do that, it's useful, saves a step later. So there, upper left 6 and 7 have been selected. It's important as a dental nurse to anticipate during the appointment or before the appointment which when the dental x-ray is going to be required. You need to set up the Nomad 2 and check, the first thing is turn it on and then check that there's sufficient battery. You should always be checking the battery level to make sure that the dentist has battery to take x-rays during the day. It does take a long time for the battery to charge, so if you run out, and it can be a problem. Yeah, the nurse will then set up the sensor using a targeting device. Routinely, we advise using a targeting device because it reduces the number of failed exposures. The sensor is prepared using a protective sleeve, which is single use per patient. The sticker that then applies to the sleeve is also single use, and only the frame and the ring are reprocessed for sterilisation. The nurse is now setting up for a bite wing x-ray. You have a yellow holder for a posterior tooth long cone periapical and a blue holder for a anterior long cone periapical. Sometimes the dentist may not use the sensor and may use a patient to position the sensor within the mouth due to difficulty of having a large targeting device in the mouth, but where possible a targeting device is recommended. Once the dentist has taken the x-rays, the nurse is then able to process and assist with the labelling and quality assurance record of each x-ray. You can see here we're setting up for an intraoral x-ray, and a test x-ray has been taken by the dentist. We then have an image on the screen. You press exit or quit to then move to, it saves all images that have been taken. It will then ask you to automatically fill in the labelling, so label which tooth the dentist took the x-ray of, so either specific teeth for long cone periapical or the side panels give you options for bite wings. You then have a quality measure, which either 1 means perfect, 2 means clinically diagnostic and a retake not necessary, 3 means that a retake was necessary. So you record this, you can ask the dentist for feedback on which one it is, and then you label it either as a bite wing, a periapical or a panoramic. This is important because this is how we use the software to do a continuous audit to measure the quality and the number of x-rays we're taking. It's important when using a handheld x-ray device to make sure that you're continually checking the battery level. The battery does last a long time, but it needs to be checked on a sessional basis to make sure that you've got good amounts of charge. It's very easy to charge it between patients, but if it runs low and you need to take an x-ray for that patient, it takes a long time to charge, and you're likely not to be able to take an x-ray for that patient. It's very simple. You just plug it into the charger and make sure that it's got a good connection and that you see the charging lights illuminating. Thank you for watching this practical guide to radiation protection for evidence in the skin. This is not a comprehensive description. It's merely intended as a way of training staff on their responsibilities and how they can help manage radiation protection and manage the x-rays better within the practice. For further details, please read the radiation protection file and refer to the local rules which are stored in the dental surgery and in the OPT room.